It is World Sickle Cell Day coming June 19. Generally, the world celebrates it and actually kind of upholds the fact of advancement in technology, bringing forth good progress. But streamlining it to Cameroon is talking about ensuring that the community is empowered so as to see that the patients, not even the patients, but the warriors, are well treated. We will be talking with someone today who, of course, has lived with so many of these warriors. She has a passion for them and she wants to ensure that they live a better life. She is a unique personality, a medical doctor, and of course, she is here with us. Her name is Dr. Betsy. How are you doing?
I'm fine, Mrs.
You're
Bibian.
welcome to
Thank
the program.
you.
It is another time I'm meeting you again. This is the second time we're having a program together here.
I'm telling you.
Yes.
Finally.
I'm just so very glad that you made it. It is finally that time of the year again when we'll be talking about sickle cell a little more. And this year, you made me understand that they're kind of streamlining it to the community, ensuring that there is that awareness in the community. Why do you think there is that need for the community to be a focal point with regards to this celebration?
All right. I really think that, well, if I have to really give my point of view about sickle cell disease and what the community think about it and what they should do and how they should approach this, is by empowering young people to sensitize about this condition. And I would like to say that it's quite unfortunate that we just wait for the month of June to sensitize against sickle cell disease. And trust me, it's not enough. 1 month in a year for a chronic condition like this, which is genetic and can be fully prevented. I really think 1 month or 1 day, I will never even say 1 month because it's just 1 day, 19 June, and you realize that that's when we'll notice that there are many associations and many people who are fighting against this disease just when we enter into the month of June. Meanwhile, when we look at the condition and the prevalence of sickle cell disease, though we can't have like a full prevalence here in Cameroon, we are still like at the level of 2 to 3% according to what a study published by the World Health Organization done since 2006. Right now, we don't really have like concrete data about the prevalence of sickle cell disease in Cameroon as a whole. Meanwhile, it's a serious public health concern. So when we look at it, do you think that 1 day, 1 month, the month of June is enough? No. But it's something that is supposed to be carried out. It's an everyday battle. It's an everyday fight. It's something that we should empower the community, educate and raise more awareness for young people, adults. I mean, everybody is concerned about this, whether you're a police person, whether you're working in the hospital, whether you're working in any organization, whether you're in health or not, you're into health or not, this fight concerns you, and I think everybody should be educated or should advocate for this cause.
Now, Dr. Dora, you're a young person, and of course, when you're talking about prevention, it brings me to the fact that you have an organization, a foundation actually, which is aimed at seeing to it that these warriors are well taken care of. What do you think as a young person you can do to prevent, to begin with, because you mentioned prevention?
Yeah. Okay. As a young person, what I think you can do to prevent this disease, because like we said, sickle cell disease is a genetic disorder that affects the red blood cells. And it is just, when we talk about genetic, it means it is transmitted from parents to child. So to prevent this disease, it means that it's two people that come together who are not compatible. So as a young person, before thinking of being in any relationship, before thinking of engaging yourself with someone, when they just ask you what's your name, you just ask what's your genotype too. So
okay.
Yeah, so that's what I encourage young people. Don't wait to be in a relationship before knowing your genotype. If you hear about this today as you're listening to me, know your genotype now for once and for all, so that you're not going to find yourself living with a condition or being a reason why a child is going to suffer all his life because of genotype status, because two people love themselves. So children now become victim of your love. So as a young person, even if you're in secondary school, know your genotype now, and you know that when you get to the university, you want to be in a relationship, you are already conscious of it. Yeah.
Now, before we leave, I want to find out this thing. The global theme is talking about the hope. Of course, they're talking about advancement. Are there some innovations so far that can give that hope?
Yes, there are innovations because today there is what they call neonatal screening, and it is helping because before the age of 5 years, that a lot of babies are dying. In those days, the mortality rate was actually high because it was difficult to diagnose it as early as possible. It was difficult to actually, because it was difficult to know the genotype of the child. So most of the time we realize that babies are dying early because they were not able to screen it or identify or diagnose it as soon as possible. But today there's what they call neonatal screening. So when they just give birth to a baby, because the logic was first like when you reach 6 months before they can test you, but today it has changed. Before even that 6 months, they can already know the genotype of the baby because things are actually changing. That a lot of innovation. So neonatal screening is going to help. It's going to go a long way as well to reduce the mortality rate of children less than 5 years. And it's also going to go a long way to also building that sickle cell free community, and it is being carried out almost everywhere. And there's also today, like when a lady is pregnant too, they can also do like test the fetus to be sure that this baby, whether he's actually, if the baby is carrying sickle cell disease or is suffering from sickle cell disease or not. But this, I'm not going to counsel somebody to go and like enter into a relationship and later on probably getting pregnant with somebody with whom you're not compatible after they have to do the testing, and when they discover that the fetus is having sickle cell disease, you have to start committing abortion. And we all know that abortion is not something that is fancy. It's not something interesting because it's having a lot of complication. You can lose your life. You can lose your uterus. That a lot of, so prevention is better than cure.
Yeah. Yes or no? This test you're talking about, is it affordable?
No.
Thank you very much. It is with that note, ladies and gentlemen, that we come to that end of that section of the news. But we continue, of course, and we're first of all very grateful to the fact that you're here, and we'll be celebrating together. Yeah,
of course.